All right, sorry, America. This conversation continues. If you only knew. Sorry, America. Support for emergency care patients barely receives a passing grade in this country. The American College of Emergency Physicians issued a report card assessing this country's emergency medical services. And as a whole, the United States got a measly D+. And on top of that, Texas is one of the worst. Here's our own Lisa Pinero with more.
Well, not great news. Texas is again sinking to the bottom of the barrel on a national health care measure. The state ranks 38th in the nation, down from 29th, for failing to support emergency patients. And this is according to the latest report card from the Dallas-based American College of Emergency Physicians. So Dr. John Hirshon led the task force for this report. And Doctor, let's talk about this report this morning. You said you've worked for about 2 years on this.
Yes, there was a task force of experts in a number of different areas, including access to emergency care and quality and patient safety, that worked for 2 years in collaboration with ACEP to put together this report card. So
let's talk about the good first with Texas. We actually scored very well. We got an A when it comes to medical liability. Explain what that is.
Well, what that looks at is kind of the medical liability laws that support the environment for emergency care. And in this instance, the reason medical liability is important for patients is that if you're in a state in which there's very poor medical liability, you may not be able to get that on-call physician, say a neurosurgeon or a hand surgeon, when you go into the emergency department because they're not taking call.
Okay,
and Texas did a really nice job there. Their A is I think a testimony of their model, and it shows how one state can get something right.
Very nice. Okay, we also did relatively well. We got a B- in quality of patient safety.
I have, quality and patient safety is another area where you look at a number of different components, which includes the EMS system and how well the environment supports patient safety, So, because I have a slightly different grade for Texas.
Oh no, I'm sorry. I was reading the grade from 2009. No, we did very poorly. This was one of the areas that we went down to an F. I'm sorry.
Yeah, I was wondering because really, it's an area that really looks like it needs substantial improvement. I mean, you did well before, but there have been a lot of changes in Texas over the last 5 years, and I think this is clearly one of those areas where Texas has gone down.
Yes, we've gone down in many areas. So I guess for more of the bad news, access to emergency care. Unfortunately, we were an F during the last study in 2009. We're an F again. Why can't we get this right?
Well, I mean, this is really a critical component of the report card. This is 30% of the overall grade. And the reason this is important is because when you need to go to the emergency department, you need that system. And this looks at, are there enough physicians? Is there insurance to support so people can access care? And not just emergency physicians, but primary care physicians. So there's a number of different components. But in this instance, for Texas, it's really the lack of kind of the financial barriers for many patients to be able to access emergency care. So, the fact that there's poor reimbursement for Medicaid, not a lot of Medicaid for people, those are the areas that really, I think, impact ability of patients to get the emergency care they need.
So, Doctor, is Obamacare going to help with any of this? Do you think that now that this healthcare system is in place, more people are signing up, will we see better grades next time around?
Well, yes, but there are challenges. So there's going to be increasing demand and limited resources. So we already can see a recent article in Science 2 weeks ago that looked at the fact that folks with insurance go to the emergency department more because they now have insurance. So there'll be increasing demand, but part of what we measure is whether or not people have insurance. So that would improve in states that that had poor Medicaid coverage in the past.
We also went down in public health/injury prevention. Can you explain that one?
Yeah, public health and injury prevention looks at a number of things such as smoking and laws for graduated drivers and car seats. And the reason this is important from an emergency perspective is that about 1/3 of the visits we see in the emergency department are for injuries. And so if we can do things to decrease that burden, to decrease the likelihood of injuries, then that's a way to improve the grade in public health and injury prevention.
Okay, in your recommendation, what can Texas lawmakers do to bring our grade up in these very, very important things?
Well, there's a couple. First, I think they should continue to support the strong medical liability environment. But I think they need to look at access to emergency care. And really, you know, the report card is a roadmap because there's 136 specific metrics within it that they can look at and decide which ones they want to tackle. But improving insurance coverage, I think, is really one of the critical ones for Texas. And I think people can go to our website, emreportcard.org, and take a look and see how Texas did this time, how Texas did last time, and how Texas does compared to the rest of the country.
Well, Dr. Hirshon, thank you so much for being with us and sharing this information. You know, it's not great news for our state, but certainly something that we need to look at and fix in the future. So thank you for being with us.
Oh, thank you, Lisa. I think it's a great call to arms to get people to act.
Agree. Thank you. Jeff, back to you.
Thanks, Lisa, for that call to arms. Exactly right. Speaking of medicine, up next on the Texas Daily, we're going to meet a nurse who goes above and beyond the call of duty brought to us by the one and only Billy Bob. That's coming up next. Stay here.